It was great seeing the diversity, more women involved, people from other countries coming, and just this sort of coming together of people interested in studying together and educating each other and connecting socially. I think that was really impressive for me.
Anesthesiology 2018, bringing us together.
Coming in, seeing different people from different places, seeing what people are doing in other centers and trying to compare that with your center, see where you can get better.
This is ASA TV. It has been a busy week here at the Anesthesiology annual meeting. From the latest research to the unveiling of a new logo, look, and feel for the American Society of Anesthesiologists. The joint ASA-ACHE panel session on strengthening physician leadership through synergistic partnerships became a much more intimate lesson on leadership, featuring outgoing ASA President Jim Grant, ACHE Representative Chuck Stokes, and ASA First Vice President Mary Dale Peterson. The panel was able to share a wealth of experience through interaction with the audience.
If you have an engaged employee group, an engaged medical staff, you're doing quality work and safe work in your organization, and you're given a good patient care experience, the financials will take care of themselves.
For me, it's personally, even from the questions I was able to ask, give me some markers, some breadcrumbs, if you will, of things to follow and to make sure I'm doing now, and reinforce some things that I've already started in my own career. And I was even, while we were talking, I was even looking up different business school programs and seeing what they're involved with based off of the feedback given in the panel. So it's really already affected me quite a bit, and I plan to talk to some leaders when I get back home of what I should be doing in the next few years to plan for that.
Helping to wrap up the Anesthesiology annual meeting was the 2018 John W. Severinghaus Lecture on Translational Science, entitled "The Future Starts Here, with Cues from the Past." Dr. Karen Domino became passionate about patient safety. Even though it's been improved significantly, severe anesthetic complications still occur. Her passion for patient safety and extensive experience links past outcomes research with new methods to advance patient safety and quality. Attendees are taking note.
Maybe we can just think a little bit differently and then see that whether that can make a better judgment and better patient outcome depending on how you are making the difference. It's not about the knowledge only of what the problem is and what the diagnosis and what the treatment is. I think all physicians know that, but it's a lot beyond that, which is what we need to learn and act upon.
When lives are on the line, having a crisis management plan can make all the difference. In a hands-on workshop, physician anesthesiologists learned the value of team training.
What's happening? He was fine. I was just getting the car.
Groups went through a series of emergency room simulations. Afterwards, they debriefed, exchanging ideas as to what was wrong and what they could have done differently.
Every aspect of it kind of stays in your head just a little bit longer, mainly because of that anxiety that you're experiencing at the time. And a lot of it is the teamwork and communication, which you don't really experience on a day-to-day basis.
This is critical. Experiential learning, first of all, is influential and does change behavior. So immersing people into an environment in a rare event, working with colleagues and teams, with what they believe has, there's no patients at risk, but there's definitely, they're putting themselves out there, and being able to ramp up the situation, being able to have them take care of critical events, and then be able to reflect on their performance is unrivaled.
Several states are changing their medical marijuana laws. That has many in our industry looking for guidance on advantages and disadvantages. Speakers presented their case both for and against, letting physician anesthesiologists decide what's right for their patients. Science is proving pivotal to improved recovery after patient surgeries. Researchers reveal the parallels of how their studies are helping to lead to faster healing.
Ultimately, what we're looking for is a way, one, to identify those patients who are going to, in my vernacular, fall off the cliff because they've got an abnormal immune response, identify those patients, and then hopefully do some kind of prehabilitation before surgery so that we can correct their immunological response to the forthcoming surgery.
I thought they gave a great overview of the preclinical basis for how important immunology is in a lot of the clinical problems that we see, because we deal with how the patients behave at the end, but we don't necessarily appreciate all the things that contribute to making them behave in that way.
Physician anesthesiologists come to the Anesthesiology annual meeting from around the world. The education here is incomparable.
You see, this is a very large gathering. You can find people, literally speaking, from everywhere. You see, that's a vast amount of experience one can gain from personal contact. Also, the subjects were very variable, ranging from all aspects of anesthesia, pain management, and intensive care. That would be really a scope for any anesthesiologist to come here.
I get to know a lot of brands, the new technology. I think it's very important for me because back in med school, they are always talking about new investigations, new technology, new products, and it's very good for me to attend here because I can go to my country and speak about that, what I've learned here.
I'm working at the moment in England, and across the oceans we need to change our ideas. That's why a lot of my colleagues and myself, we do come to this meeting to share our ideas and knowledge.
Don't forget, you have until December 31st to claim your credit. To do so, use your ASA credentials and go to asahq.org/annual meeting. For ASA TV, I'm Ed Highland. We'll see you next year at Anesthesiology 2019.